So a few common tips and tricks when you're working on integrating your Kegel connection as well as facilitating that Kegel connection with your breath. So a few things and a few keywords and visuals that I like to describe with my patients include the following. So when you're thinking about the connection of your pelvic floor, you want to think about, like I mentioned, that connection from the posterior end of your pelvic floor, which is living around the rectal opening, all the way to the anterior portion of your pelvic floor, where the vaginal and the urethral opening live. So it's that whole sling from the back to the front that you are connecting to create that lift upward. Now, often people sometimes think, I'm not sure if I'm doing it right. So one of the things I kind of tell my patients to think about is when you're connecting in the beginning, right around the anal opening, I want you to think about trying to lift up and in as if you're trying to prevent letting gas to come out. So sometimes if we feel like we may be having that come on, we reflexively try to kind of lift up and sort of clench those muscles there to hold off on letting that gas pass. And so that is one way to kind of think about, because it's the same muscles that we use in order to activate that posterior pelvic floor to prevent that event from happening. So think like you're trying to prevent gas from passing as you initially connect. And then as you come to the front, think about if you really needed to go to the bathroom, how you're like, oh, I really can't go yet. It's not an appropriate time, how you automatically sort of clench those muscles to hold your bladder in from voiding. So it's that whole idea from the back to the front, those two ideas that you're lifting up and in to create that optimal Kegel connection. Now, as you are relaxing, oftentimes people think they've relaxed, but often they still have more relaxation that they could achieve. So what I usually like to describe with that is, as you relax, I want you to think about the pelvic floor lowering and almost blooming or opening and blossoming. So that idea that you were preparing yourself to void or to pass urine if you were sitting on the toilet. And if you think about that idea, if you were to totally relax that pelvic floor, you'll feel that release of pressure and that opening through the bottom half of the muscular sling. So again, to review, when we're contracting, think about like you're trying to prevent gas or urine from coming out, and you're quickly and actively lifting up and in to hold all of those activities from occurring. And then as we inhale, we release that as if it were safe or appropriate to void, or if you needed to pass gas, to let that happen. And if those muscles are relaxed enough, those activities are possible. So thinking about that next time you connect your Kegel might be able to help you troubleshoot and better assess whether or not you're doing it properly.